Hey, it's Rebecca Smith from the KBIA newsroom in Columbia, and it's time for Missouri Health Talks, a project where we listen in on Missourians' conversations about access to healthcare. This week we hear from Evonnia Woods. She's the senior outreach producer for Reproaction, an advocacy organization focusing on reproductive justice. She spoke about the way that intersectional issues like transportation, poverty, and racism can impact Black maternal and infant mortality. Here's Evonnia.
There's nowhere for people to go to birth their babies or get gynecologists or the reproductive healthcare that they need. So they have to travel an hour to and an hour from, which presents some really dire situations for some people who may need emergency care in that way, or to have their health monitored while they're pregnant. I think a lot of times we think that pregnancy is what women are born to do. It's what our bodies are designed to do, but it's such a complex thing. There's so many ways that it can go wrong, and there's so many ways that people's health can be affected. So there's that in the rural areas. Transportation is also an issue in urban areas. I know we really think about that in rural areas, but in St. Louis, it's also transportation. It's also poverty. Racism plays a huge role in that, in the way that the transportation system has been constructed, where the bus stops are, where the train stops are, and the proximity that people of color tend to live even in urban areas from hospitals and from healthcare facilities, to receive quality healthcare, and then to come across physicians that are culturally aware or educated in the ways that they need to be. So all of that factors in. We have the know, we have the knowledge. We have everything we need right now as far as physical resources to go to prevent these deaths. And that's the key word, prevent. When we talk about maternal and infant mortality, nearly all the deaths are preventable. And we know that when we look to other countries, other industrialized countries in the world, our numbers far exceed theirs. We're the wealthiest nation in the world, and we have the worst maternal and infant mortality rates. So it can't be the technology. It just can't be that, because it's not happening everywhere. You know what I mean? We expect it to happen in poor countries, but here we are, the wealthiest country. It's happening here. So what is different here? What's happening here that isn't happening in Finland, that isn't happening in the UK, that isn't happening? You know what I mean? What is it about the United States? So a big chunk of that is racism and all the ways that it manifests into creating this situation where the most vulnerable among us, the most marginalized among us, are the most directly affected by the policies, by where the money goes, the funding to healthcare, the funding to transportation, and the funding to education, right? How we think about sex, how we think about sex education, all things that seem separate and how they're connected.
That was Evonnia Woods with Reproaction, speaking about how many factors contribute to the rates of Black maternal and infant mortality in Missouri. That's it for this week's Missouri Health Talks, which was reported and produced by Rachel Schnelly. Tune in next week for more conversations from throughout the state about health and access. I'm Rebecca Smith. Thanks for listening.